Hello, everyone. Welcome to another ASG podcast from the ASG Technology Committee. My name is Ryan Law. I'm the current chairperson of the ASG Technology Committee. Our committee provides reviews of existing, new, or emerging endoscopic technologies that have an impact on the practice of GI endoscopy at large. Our goal with these status evaluation reports is that we provide evidence-based methods using Medline literature search to identify pertinent clinical studies on the topic, including manufacturer and user facility device experience, database search to identify the reported adverse events of a given technology, in addition to the benefits and overall on-label and off-label uses. Our literature searches are supplemented by accessing related articles featured on PubMed and scrutinizing pertinent references cited by other identified studies. We emphasize the use of controlled clinical trials during creation of these documents, but in many cases, randomized trials are lacking, such that large case series, preliminary clinical studies, and often expert opinion is used as a replacement. Overall, we gather technical data from traditional and web-based publications, proprietary publications, and informal communications with pertinent vendors to create these reports. The technology status evaluation reports are ultimately drafted by one or two members of the ASG Technology Committee with oversight from the chairperson as well as the other ad hoc committee members. Overall, these documents take often 9 to 12 months for creation from start to finish, sometimes shorter, sometimes longer, but a tremendous amount of effort is put forth by our committee members for creating these documents. Today, we would like to talk about a recently published article on personal protective equipment. The main authors for this particular document are Allon Kahn from Mayo Clinic, Arizona, and Sam Hahn from The Ohio State University Wexner Medical Center. So with that, I will bring our authors into the mix here and ask them a few questions to provide context for this particular document and its relevance for our readership. I'll start with Dr. Kahn. Dr. Kahn, why do you believe that this was an important document for the tech committee to create or update at this particular point in time, or the time in which it was initiated?
Thank you. Yeah, great question. And thank you again, Ryan, for having us here on this interview. So, this discussion surrounding the topic of personal protective equipment, I think it would be no surprise to our listeners, came about as a result of the COVID-19 pandemic and, us thinking about what we could provide to our readership and to the members of the ASG in terms of valuable information in their practices. There was a lot of attention and focus on PPE around the time of the pandemic, and we were really interested in providing new insights because the pandemic spurred some research into not only sort of infectious risk and the milieu of endoscopy as it pertains to infectious pathogens, but also how protective equipment helps to mitigate that. So we felt like it was a good time to incorporate some of that new literature and provide a deeper dive for our members into what exactly is available in terms of protective equipment, how it works, what choices they can make in their practice in an informed way. And so that was really what motivated this effort.
Thanks. I completely agree with obviously the importance of it in the setting of COVID-19. I also think in the broader context, it's a good refresher for all of us to recognize the importance of personal protective equipment. Certainly, the pandemic was something that none of us had previously experienced and hope to never experience again in our lifetime. So there's so much that came about because of it. And I think that creating a document such as this is critically important for what all of us do on a daily basis. With that, Dr. Hahn, Can you give me kind of a brief outline or summary of what you think the most salient points or highlights of the proposed document are?
Yeah, thanks, Ryan. And again, thank you for you and the ASG for giving us the opportunity to talk about this technology document. I would say the big kind of items that we outline are really regarding the use of masks, gowns, and gloves, among other things. But those are the kind of the basic equipment that we're using every day in the endoscopy suite. And I think one thing that I found very interesting was that there really is a lot of really a paucity of data regarding endoscopy specific personal protective equipment use. So much of our our guidance is extrapolated from the surgical literature. But regarding the use of masks, I think all of us got very comfortable, performing endoscopy in N95 respirators. We also do highlight the use of the half mask respirators as well, and really kind of just ensuring that we have filters that are able to filtrate at least 95% of all the particulates in the air. And then in terms of gowns, previously we didn't really pay much attention to gowns, and we kind of just used whatever the nurse gave us, really. But now kind of having a standard for using at least level 3 barrier gowns every time we perform an endoscopy. And most of the companies now have kind of adopted that. And so we're all utilizing level 3 gowns. And then in terms of gloves, I think one of the interesting things we found was that randomized trials in the surgical literature have consistently found that double gloving is the best way to prevent kind of perforation through the skin, through the gloves. And that's something I had not been doing previously during an endoscopies, but now I'm double gloving just to ensure kind of adequate safety regarding that. But I would say those are kind of the big points regarding the actual equipment use.
Another thing that I think is interesting is that this paper also talks about donning and doffing equipment, which I have to say, I suspect many of us never thought about prior to COVID-19. As somebody who, for good or for bad, is probably a PPE minimalist, I actually can't stand having a mask on my face, like, period. So for me, COVID-19, wearing N95, and sometimes another mask over it was actually personally challenging. But I think it's brought a lot of these things to light and at least made people aware. Again, hopeful that we never have to put any of these things into play again, but certainly made people aware. Dr. Kahn, how kind of to build on what Sam and I were talking about, what has changed at your institution since kind of COVID has seemingly gone by the wayside in terms of how you guys manage PPE, post-pandemic?
Yeah, I think that's an excellent question and something I was hoping to touch on. And I think we can all sort of answer for ourselves and for our practices. I think that what's interesting is that I think back on the pre-pandemic time and how even back then there was quite variable practice in terms of what people would use for PPE. And I remember some practices back then that I observed that, based on what we learned from writing this article, really don't make a lot of sense, right? So, it's hard for me, it's interesting you say that about masks. It's hard for me now to imagine doing endoscopy without a mask, but I know other people feel differently, right? And it's hard, I used to see people not even take off their gloves and just go type on the computer, right? And things like that. So you think back on those kinds of behaviors. And at the time, I think there was nothing unreasonable. It didn't seem out of sorts. But now I think we have a new lens to view that through. So, for me at our institution, and I suspect this is common, there is some variability now. And I think the day that we announced that masks were no longer universally required, I immediately saw variability in the way people approach that. So, I've seen people who have gone to not wearing masks during endoscopy. I see a lot of people, myself included, who are still using them. I'm still wearing eye protection during endoscopy because, in writing this article, and we highlight this in the manuscript, that there are some data about the way that particles get dispersed during aerosol generating procedures, how they drift about the room, how they're found in different locations throughout the room. So I sort of take the opposite approach. I'm a little bit more maximalist with PPE, but I think it's a very personal choice. And I think that's the beauty of having a more informed approach, is that everyone can read the document. They can get a sense of, what they're using, why they're using it, and then make a choice, personally, and also depending on the specific nature of the case, right? So if we're doing a hospital patient who's got an infection, that's very different from, a screening colonoscopy. And I think we have to modulate our approach. So that's what I'm seeing, is a lot of individual variability.
Yeah, and I would say I see the same. There's certainly people who continue to be a bit more maximal in their approach. There's certainly people who have a very, very low threshold for using an N95 still. And I agree that it is kind of a personal opinion within reason. Certainly I would hope that all of us, around the country have a very low threshold to increase our PPE usage. That's one thing that I think I've found most interesting is, thinking back pre-pandemic, if a coworker or even yourself had a cold, you wouldn't necessarily go and grab a mask. You might, if you were really diligent, or you might just say, hey, I'm going to wash my hands 100 times. I'm going to stay away from my colleagues, or, cough into my elbow, or whatever it may be. But I think now people's threshold for wearing a mask, if they feel the slightest bit off or have a cold or cough, whatever, has increased, which, is a good thing, certainly. So I think that it has brought this to light overall, and improved, how we care about ourselves, how we think about our coworkers, patients, so on and so forth, in a very positive way. Is there any additional things you guys would like to highlight regarding this particular document, in addition to the PPE? I think there were some smaller sections, one that I can recall on radiation safety. So anything else that you would like to add as an additional kind of salient point for the article? I'll start with Allon and then go to Sam.
So I think along the topic of radiation safety, we actually just had a recent document that was published through the ASG Quality Assurance and Endoscopy Committee, and we highlighted that in our manuscript. And so, we had initially planned to go deeper into that topic and had done some preliminary research along those lines, but then we were informed by the ASG leadership that there was a document forthcoming, and so we left that to the experts, so to speak. And so that's a great document. It's very comprehensive, and there's a lot of interesting information and some technological advances in that area that perhaps you and Sam could probably speak to more than myself, because I'm doing a lot less radiation cases, a lot less fluoro, but definitely some interesting advances there that I encourage the readers to look into. Just one other comment that I would make based on what we researched was that these are not the best design studies necessarily, but there are some studies which indicate that that eye protection is very important for mitigating infectious risk. So that's another thing that I would say I've seen often get sort of left out of the conversation day to day, and so I think it probably is not altogether necessary in your routine non-infectious cases. But if you're dealing with a patient with an active infection, especially something that could be airborne from the procedure, then I think eye protection is also a really important thing. And there's a whole section here about goggles and face shields and protective eyewear. So I encourage the readers to also look into that.
All right, Sam?
Yeah, those are all great points by Allon. I just want to highlight also, we do talk about kind of certain specific disease states when performing endoscopy, such as C. diff. I think C. diff is really going to be the one that we most frequently deal with as endoscopists, but really the importance of having gloves and gown on before you enter the room, and then obviously washing with soap and water after the case, and then basically taking off your glove and gown and then exiting the room. Kind of maintaining those kind of standard precautions. And then also, I think it also draws attention to the fact that we need negative pressure rooms to perform endoscopy on a day-to-day basis, particularly in the light of, in addition to COVID, but like diseases such as tuberculosis, which we rarely see, but we do in large tertiary centers definitely see on a somewhat regular basis. Just making sure that we have endoscopy rooms that are capable for dealing with those patients. And then also, I think this has really brought a lot of attention to the need for kind of standard cleaning and disinfection after cases where we either do a negative pressure room or, like, for example, a C. diff case, how we really do have to ensure that the room is clean before the next patient comes in. And then one thing that this document also like slightly touches on is kind of the need for further research into this field. And, you know, with radiation, I think the field, at least the advanced endoscopy field, has done a fair amount of good randomized trials in terms of different devices or ways to reduce radiation. But I think in endoscopy sphere, this is really wide open in terms of doing trials to figure out what kind of gloves or gowns are going to be able to best protect the endoscopist from infections as well.
Yeah, those are all excellent points. It's also, you know, you touch on about cleaning the room between patients. You know, I've done endoscopy now in a handful of countries around the world, and I can tell you that the variation in centers in the US, but also around the world, is tremendous in terms of protocols. So, you know, there really is no standard. You know, I can tell you what we do at our institution is what I believe a pretty deep clean between cases. I assume similar at both of yours, but it's not necessarily that way at every institution I've ever worked at. So, you know, that's something that we certainly need to consider. The other thing I always find interesting is, you know, discussion about the sterility of devices we use. Essentially, as soon as these devices come out of the package, no matter how clean the room is between patients, as soon as they're set on a table or a cart or a boom or whatever, the sterility immediately becomes questionable. So, you know, I think that there's a lot to be discussed in terms of how deep we want to go down this rabbit hole in terms of making sure things are truly cleaned and prepared for the next particular patient versus making ourselves believe that things are cleaned and so forth. So that's a really, really good point in terms of not just the equipment we wear, but the rooms that we work in. So with that, we'll just wrap it up. I really appreciate you guys joining me on this podcast. I think this is something that is beneficial to our readers, certainly helps to bring attention to the documents that we work so hard to create. So thank you for taking the time today. And again, for our readers and listeners, this document will be available in the summer edition of IGIE. With that, we'll close. Thank you again to Drs. Kahn and Hahn. Thank you all.
Thanks, Ryan.
Thanks, Ryan. Appreciate it.